Hi, I'm your host, Marsha Florence for Just Ask Talk Show, and welcome to Just Ask Live podcast. Well, ladies and gentlemen, today is the day for me to do what we call a recap. So, first, I want to thank you all for joining us. It's an opportunity that during this time we have to find ways to keep connected with our viewers as well as our resources. And so, in the process that we're using Zoom, as you see, we hope that we can still provide you with the accurate information and resources that you have become accustomed to. During the time right now with COVID-19 in place, you do see we're not in the studio where everyone's working from home, which some of us has adjusted and some of us have not. I'm between the to and the from. So today we're going to do a recap of who we've seen so far during our Zoom process. But you can also catch the show on our website, justastalkshow.org, or you can always go to YouTube, channel 56, all of our cable services. There's so many now. So if I miss the name of them, don't panic. You can always just call us 1-800-323-5336 and ask us, do we air in your cable network, or what days and time for channel 56, which is Wednesdays at 5:30 a.m. And then we have a new time coming aboard that we'll talk about shortly. So, as usual, I tell you, I may not always have guests, and that's a good thing because I want you to get accustomed to knowing that even though I may not have guests, I have some resources for you to discuss and open up your ears to that you may not be aware of or that you should use at this point. So, with the recap today, we're going to go to the first person that I had as a guest, which actually you won't see Patricia Renter of the Urban News, but you'll see copies of some of the pages. So what I'm trying to do is start with this page here, Urban Aging News, and that is the publication paper that Patricia Renter and her staff produce. And what I like about this paper is that it holds a lot of resources for you to utilize for yourself, for your loved ones, for the lady next door, or whoever. Okay, so what you get out that paper is a lot of information that you've probably been struggling trying to find and can't and don't know who or where to look at. And so I'm going to highly suggest that you uh, contact Pat Renter for that paper to be sent to you electronically or by mail. And if you don't see the number at the bottom of the paper, then give us a call at our number, 1-800-323-5336, and we'll request it for you and get you her information so that you can connect to her. Now, I wanted to go over some of the pages that Pat Renter had discussed earlier. So the first one, I believe, let's see, what is that one? The Dial a Doctor. Now, just think you can't get home. You're at home and you can't see a doctor. They have telemedicine now. So Dial a Doctor, which covers the fact that you can still see your doctor by phone. And because we have a situation within, worldwide, some of us don't want to leave home. So why not find out if your doctor will speak to you by phone and if you can see your doctor, which is a process too. Telemedicine has a process where they can actually see face to face, which is like Zoom, okay, or a Duo, so that you can actually see and talk to the doctor. Now, that doesn't take the place of going to the doctor. We know that. Okay, so if you do have an emergency, you got to go in. If you need some blood work done, you need to go in. But if you're just getting the test results, or if you just want to know, I'm not feeling very well, can you call my prescription and this and that, you can request a telemedicine call from your physician. And trust me, Blue Cross Blue Shield, Medicare, Medicaid, what's it, Humana, um, well, who is it? Half, all of them are going to still build the same. So it's not like you're missing out on anything if you don't see the doctor. See the doctor if you can see him, and if you can't see him, then always know that you can make that phone call and get an understanding of your condition by way of telemedicine. Okay, now from there we went to, let's see, she had another page. So what's page 6? I'm trying to figure out what I'm looking at. Oh yeah, my nursing homes. Okay. I'm always concerned about nursing homes. So you see it says how well nursing homes reopen to the public. How will nursing homes reopen to the public? If you have a loved one in a nursing facility and you have not seen that individual as of date, you need to contact the facility and ask them what methods are they using to allow you to have visitations or some type of communication with your loved one. Okay. So what that means is that you have a loved one in there that's already ill, okay, and is of age, and they're missing their family, and you should be missing them as well. The nursing facility that you have your loved one in should have established some type of communication points, whether you can ask for, and this is to be considered, to have a video of your loved one. In other words, use your phone. You want to use your phone, and you want to have a duo conference or something, or Zoom, that you can see your loved one and they can see you and wave and say hi, or just some way of communication. They also, some facilities have taken on the ability to put their loved ones, have residents in a garden, okay, an open area outside where you can actually visit them outside. Okay, so if it's on the grounds, it should be in the garden. If they also, some of them have established a point where they're using some type of plastic shields where you put your arms through and still hug your loved ones. People, we need to be able to see our relatives. Now, I don't know about you, but whoever's in the facility, they're there because you're saying they need to be there for additional help. But regardless to the additional help, they need to have eyes on their family members so that they know that they're safe and that they're loved. So any way you can, you need to contact your nursing home facility where your family members are and ask them what is the procedure that they're using for communication with the outside world, which is the relatives. Okay, so from page 6 we went to page 8, which was the virtual touch helps. Okay, so that's the part where if you're using the phone, you can use the phone to communicate with someone. Okay, and that's where you see the people in Zoom or Duo or whatever phone method that you have to contact the individual, and you can see them. That's the one you want to see, you want them to use. Now everybody may not have access to a phone, so that's why we need to make sure that if you don't have online therapy of some sort, which may could be arts and crafts through a phone system, and then you can see the person doing the class, the yoga class, some type of exercise fitness class, or just to talk to one another. Okay, that is the virtual touch. Okay, so that's Henry Ford Health Systems that designed that. Give them a call, and you see it says support caregivers. So it's for the caregivers as well as for the one you're caring for. So if you don't have an idea of how to communicate with your loved one, then contact the Henry Ford Health System and ask them about that virtual care. Okay, virtual care touch program. That way you'll have an idea of what services you want to use. We don't want to just tuck our people away and still can't get to them. And I'm not one to take somebody's word every day that, oh, she's fine. She's fine. No, 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 no. I need to see my people. Okay. So however you see fit, try to find a way that will comfort your mind as well as your loved one's spirit, that they're loved and someone is looking out for them. I think I said before, sometime when we go visit someone in a facility, the whole family goes. You got the grandkids, the kids, and the parents. Okay, you got all the whole family to see grandma. And she can only look around once or twice and all these faces. And then after that 30 to 40-minute visit, everybody piles back up in the car and leaves, and it's going to be another 30 to 40 days. Why not, especially if you're the adults, rotate your visits? Okay, so that that loved one will know that they've seen a different person each visit, even if it's once a week. If you can't go 2 or 3 times a week, try to go at least once a week, and then do the phone conference call, the virtual phone call, duo, whatever it takes to see 2 or 3 times a week that that loved one is doing pretty good. Okay. And that way you can also keep up with the staff. Now, keep in mind, nursing home staffs are essential workers, and these people have families too, and they're tired. Okay. And they somewhat are afraid, okay, because COVID-19 is real. And how it's getting in that those nursing homes, I have no idea. But it's sad enough that we know that our loved ones are in the facility and they're supposed to be being taken care of. But now you have a dual issue. You have workers who are afraid of catching something and taking it home to their family. And then you have people on the inside that we think are safe, but somebody's bringing it in or somehow it's getting in and they're not safe. So, as a family member, you need to be able to be conscious of the fact that you can help out in the care of your loved one. Okay, so however you find to support your loved one during this time also helps the staff. All right. So and talk to the social worker. Talk to the social worker. Talk to the administration, and ask them what are some of the key points that they have or are using to support the families to make sure that the family feels confident that their loved one is safe here and it's okay. All right. Because when they did the news flash about the nursing homes, I mean, how many people ran to see about their loved ones? How many? All right. So this way, so that you don't have to run to the nursing home all the time, you should be able to communicate as often as possible by phone, okay, or by visit. All right, so moving right along from that, and that was some good information that Patricia Richard gave us, and I truly do appreciate that. But I want to go to the mental health stages of information. So I think we have like page 9 in that paper. So on that page, mental health monitoring during the pandemic. What that tells you is it's not just the person in the nursing home that's going through emotions. It's you yourself, the loved ones at home. It's you yourself, the worker, the essential worker. It's you yourself, John Q. Public. All of us are going through something right now. Okay. And so we have to monitor our mental health stages. There's outbursts, negative outbursts, frustration, upheaval, um, destruction. It's a lot going on. And you have to somehow maintain control of what's going on in your family, in your household, and with you. So each and every day that you step outside and go somewhere to handle some business, you have to be on guard, true enough, but try to keep your mental state in check. And what that may mean is you might have to start to meditate. You may have to, well, you should pray, okay? But meditation, prayer, some form of exercise, if it's yoga, if it's karate, if it's outside running, walking, anything that's going to relax the mind. Now, I'm going to tell you something. We do know some things that can trigger off the mind, and that's between, no offense, you coffee drinkers, but caffeine, coffee that's in coffee or in chocolate, okay, that can heighten a person's mental state because of what it does. But I know you like it. Okay, I'm a chocolate person, so I understand. But sometimes we have to back up off of that because we may be imbalancing our mental state with caffeine, okay, because it's a hype. And with the fact that we're wearing masks, it doesn't make it any easier for us to be comfortable because we have these masks. And wearing the mask and not wearing the mask is a big concern with everyone. Now, I'm not comfortable with stepping to someone saying, "Where's your mask?" They know who they are. Okay. And if they want to take the risk and not have a mask, that's them. Be careful, ladies and gentlemen, in stepping to someone outside of your family to say to them, "Where's your mask?" A lot has happened when people speak out, And I'm not saying that you have to cower down or anything, but just be mindful. It's a very intense time right now, and I'm asking you to be careful, but just be cognitive of you and your family members to make sure that they're doing the right thing. And sometimes you have to sit young people down and have a talk with them about what's important and how you want them to be around. So don't be so hot headed, okay? And don't wear the mask or don't follow instructions, or the police ordinance when we have curfews and this and that. Explain to your young people that they're part of you and you want to see them grow old as well. All right. So those things are some of the things that we need to be more aware of right about now in our frame of minds, because we've got a full family. It could be 1 to 10 people in a household, but it will become frustrating when things are out of order. If your mental state is shot, sometimes you have to make a phone call and talk to a doctor or a psychiatrist or someone or a support group and get a moment of R&R. Some of us feel like, well, I'll just do some housework. I'll just jog this, that, whatever's your outlet, use it. And if it works for you, then that's fine. But I always encourage you, if you have some things that you'd like to share with our viewers, give us a call, 1-800-323-5336, 1-800-323-5336. Or you can email me at Marsha at Just Ask Talk Show. And leave us a question and we'll answer it for you. Matter of fact, if I answer it, I'm going to answer it live. How about that? All right.
If you love them enough to crawl into a play place to get them to come down, then surely you'll check nhtsa.gov/the right seat to make sure they're in the right car seat.
Honey, what I think you need is a socket wrench.
I played JV basketball.
I'm sorry. I don't think it looks right.
This is good, and it's all good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/the right seat to make sure I'm in the right car seat.
I'm gonna call my dad.
We're going to move on because I know that I had a chance to collect some information also for you from Bridging Communities, Phyllis Edwards. We had the opportunity to see her a couple of weeks ago. And so on this resource page here, elder care services, housing and neighborhood stabilization, ways you can help. Let me say this about housing and neighborhood stabilization. Some of you may be in the midst of a crisis of losing your home due to taxes, foreclosures, liens, things like that. You need to consider calling Bridging Communities. And I know we have that page with their phone number available. So if you can call that number for Bridging, and the director, Phyllis Edwards herself, may take the call, or her wonderful staff. Let them know that you got their information from watching the Just Ask Talk Show, and you want to learn more about their housing support program. Now, I'm not going to tell you they're going to pay your bill, but they can help slow down the effect of the foreclosure or help you with the taxes, get the taxes under control. And you never know, you might be eligible for tax exemption on your home. If you are of a low income nature, you may be eligible for tax exemption. So those are some of the things that you have to look at. Okay, so there's that number, excuse me, for Bridging at the bottom of that page. And you may want to call that number. Okay, and when calling that number, definitely let them know that you saw it on Just Ask Talk Show. You want to see what resources you may be eligible for. Okay, so Phyllis Edwards and her group are very, very good at what they do. I just want you to be more abreast of the services that are out here. Okay, now I'm going through this because I do notice that a lot of times during this period here, some other ailments that you are experiencing in your life, you won't go see about because you're saying, I'm not going in that hospital. They got them COVID people up in there and this and that. Okay, well, let's back up. The hospitals have put together have reorganized their system to be able to care for persons who are non-COVID-19. Okay, so you may go to a hospital and they have to take your temperature and ask you some questions, and then they wheel you to another wing of the hospital. Don't be afraid to go to the hospital. Go to the hospital. Don't be afraid to visit your doctor. Visit your doctor. You know, I went to see my doctor the other day. I've never seen the office so empty, and I said this is a Kodak moment. The reason I said that is because it's always packed, and it's, you know, and you're going to wait 2 or 3 hours. Well, what the COVID-19 did is that they don't have that kind of time no more to have a bunch of people sitting around waiting 2 and 3 hours to see the physician. You either see the physician within 45 minutes or less. Okay, so they've gotten a little more organized with delivery of services because they don't want to take the risk either of dealing with COVID-19 if they don't have to. And so we rather know that if you are sick or uncomfortable, you still can be seen by your physician, whether it's virtual or if you have to go in. And keep in mind, you should. Now, another thing, while we're at it, this is prime time, ladies and gentlemen, to use your insurance. A lot of you do not use your insurance and you steadily paying, whether you are Medicare, Medicaid, Blue Cross, HAP, Humana, whatever. Go to the doctor and get checked out. Okay, stop being afraid to see about yourself. You send your children, you take your husband, ladies, but you don't go. Husbands, you make sure you got medical insurance for the family, but you don't go. Parents, you make sure that the kids are covered, but you aren't covered. Something's wrong with that picture. Back up and go get checked out. I believe in seeing every doctor I have. I'd rather know early on if something's going on in my body or my mind before it gets too late. Any type of pain or discomfort should be addressed. The body is not designed to hurt all the time, every day, without sending you a signal. It's sending you a signal, something's going on. Go check me out. So then you should check them out. Now keep in mind, if you don't go, you pay for a whole year of insurance and it's another year going by. Go to the dentist, get your teeth cleaned, or find out how much it is to get a plate or partial, whatever you need. What's the problem? Okay. So whatever monies that you have to pay, like a copay, okay, that's $20 or whatever. Work that out. They can bill you later or you can pay the copay. But to go to the doctor, go to the dentist, go to the ear doctor, go to the eye doctor, all those doctors are going to be taken care of. Your out-of-pocket expense should be little to none. Okay. I went to the ear doctor just a week ago and my equilibrium was off. And so happened they call it liquid behind your ear, fluid in your ears. Now I went to the ear doctor to get my ears clean, and then it was a discovery that there was fluid behind my ears, which means my balance was off. And I knew something was different because I kept going, wow, the room's spinning. Well, what I'm saying is, had I not just went to the doctor, we don't know if it was blood pressure issues or if it was something else, vitamin deficiency, or the fact that hey, I am a hearing impaired person and I have to be on my game about my ears. So I went to go see about myself. All right. I went to the eye doctor. You see my new snazzy glasses, right? Okay, well, purple frame. Okay. So what I'm saying is I use my insurance. I use it all the time. Hey, I rather use it and make sure there's nothing wrong and catch it early than not use it at all. And so I encourage each and every one of you. I don't care what type of coverage you have, your benefits will take care of your needs. If you're not sure, there is a number on the back of most of your cards. You can call that 800 number, find out what benefits are covered, what services are covered. Um, what percentage you may have to pay if you have to pay for out of pocket for glasses or assistance payments for hearing aids. Now I know a lot of you don't know this, but Blue Cross Blue Shield pays 50% on hearing aids. I'm telling you what I know. Okay, so you want to check into some things that you didn't think that your insurance could cover. It could be a brace for your leg. It could be an upgrade on your wheelchair. All right. You have to call your insurance companies and ask the nice people, you know, In my benefit package, is there a percentage covered by my insurance? And another key secret is these agencies and organizations are not at liberty to offer this information. You have to ask. Now you know why the show's name Just Ask. Okay, so you have to ask for what you want, and then they will respond to you. But if you think you can't say, well, what can I get? They don't know what you're talking about. Just ask them. Just say, I need to know what my benefit coverage would be if I'm in the process of getting some glasses. Is there a percentage I would have to pay out of pocket, or do I have 100% vision care? Do I have 100% eye care? Foot care. Do you know you can go to podiatrist? If you're a diabetic, you don't go get a manicure and pedicure. You have to go to a podiatrist to get your feet taken care of. If you are having some type of back pain or something, you can go to a chiropractor. And did you know a chiropractor can give a massage and it's covered under insurance? It's titled a different way, but you can get a massage in a chiropractor's office. But you can utilize all these things in your insurance package, what little that you know. So I spent time with you today to encourage you to go to the doctor, go to the dentist, go to the eye care technicians, definitely go to the ENTs, ear, nose, and throats. They my favorite, and you know why, because I'm hearing impaired. Okay, so I'm always going to be on that. All right, but I'm just want you to start to use this time while we're at home going through the COVID-19 situation to make sure that you're healthy, your children are healthy, your parents are healthy, everyone in your covenant is good. And that's my prayer for you today, that we take care of ourselves and our families, and then spread the rest of the information of resource and support to our neighbors. Miss Jones down the street, she's so sweet, but I have to look out for Miss Jones. Okay, I have to look out for Miss Jones, Mr. Jerry, Miss Bowens. I have to look out for my elders. Okay, and I feel like when I see them and I ask them how they doing today, if they say they hungry, thirsty, or just want to talk, that's what we do. Okay, so take a moment out and look to the left and look to the right and see if there's someone that you should be concerned about, to help out just a little bit. Every little bit helps, even if it's nothing but a cold glass of or a bottle of ice water, and you can give that to somebody who look like they need a drink. Okay. So without further ado, I wanted to spend time with you myself today. Of course, you will see some guests coming up in the near future. We want to thank those that we have seen. Definitely Pat Renter's information is helpful to you today. Phyllis Edwards' information is a great deal of help for you today. And we'll go back over, and the next time I see you, about Comfort Keepers and a few other home care programs that are available throughout the state of Michigan and beyond. So, what do I always say? If you know someone with a disability, or if you just have a general question, don't be afraid to ask. Just ask. I'm your host, Marsha Florence. See you next time.